you know, for the past 4 months, CDC has been actively engaged, along with the World Health Organization and other partners, in the response to the Ebola outbreak in West Africa. Since the first report surfaced in March, there have been more than 1,201 cases reported and, unfortunately, 672 deaths in Guinea, Liberia, and Sierra Leone. This is the largest Ebola outbreak in history and the first in West Africa.
There is a window of opportunity to tamp this down, but that window is closing. We need action now to scale up the response. We know how to stop Ebola. The challenge is to scale it up to the massive levels needed to stop this outbreak. Today, we are providing the information that an individual traveling from Liberia has been diagnosed with Ebola in the United States. I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country. But there is no doubt in my mind that we will stop it here. In Dallas, there are 10 definite and 38 possible contacts being monitored. Each and every one of them is having their temperature monitored. As of today, none of them are sick, none of them has a fever. We know how to stop Ebola. That's what's happening in Dallas today. That's what's beginning to occur in parts of West Africa. The signs of progress are there, but it is going to be a long, hard fight.
The chances of an Ebola outbreak in the United States is extremely low.
Today, we are deeply saddened by the death of the patient in Dallas. Despite maximal interventions, we learned today that he passed away. We are tracing the 48 people, 10 with definite and 38 with possible contact. None of them, as of today, has had fever or symptoms suggestive of Ebola, but we recognize we're not out of that 21-day waiting period, and we're actually at the peak incidence period of 8 to 10 days, so it's certainly a time when we're anxious and carefully assessing. We recognize that whatever we do, until the outbreak is over in West Africa, we can't get the risk to zero in this country. We're deeply concerned by the news that a healthcare worker in Texas has tested preliminarily positive for infection with Ebola virus. We don't know what occurred in the care of the index patient, the original patient in Dallas, but at some point there was a breach in protocol. There, though, is no risk to people outside of that circle of the healthcare workers who cared for the individual patient and the initial 48 patients or contacts who had definite or possible contact with the index patient who we've already identified.
As you're aware, this morning the CDC confirmed that on the morning of October 14th, the second healthcare worker reported to the hospital with a low-grade fever and was isolated. This patient traveled by air on October 13th. Because of the proximity and time between that evening flight and the first report of illness the following morning, CDC is working closely with the airline to identify and notify all passengers who might have traveled on the flight. Individuals who are determined to be at potential risk will be monitored.
This is not a situation in which, like a flu, the risks of a rapid spread of the disease are imminent. If we do these protocols properly, if we follow the steps, if we get the information out, then the likelihood of widespread Ebola outbreaks in this country are very, very low.
The
healthcare worker number 2, who traveled from Ohio on the 13th of October, Monday, should not have been allowed to travel by plane or any public transport by virtue of the fact that she was in an exposed group. And although she did not report any symptoms and she did not meet the fever threshold of 100.4, she did report at that time that she took her temperature and found it to be 99.5. So by both of those criteria, she should not have been on that plane.
There's a lot of fear of Ebola. And I will tell you, as the director of CDC, one of the things I fear about Ebola is that it could spread more widely in Africa. If this were to happen, it could become a threat to our health system and the health care we give for a long time to come. Our top priority, our focus, is to work 24/7 to protect Americans. That's our mission.
Unfortunately, in our initial treatment of Mr. Duncan, despite our best intentions and a highly skilled medical team, we made mistakes. We did not correctly diagnose his symptoms as those of Ebola, and we are deeply sorry.